Close your eyes for a moment and think back to a time when someone lied to you. Chances are we've all experienced that hundreds of times in our lives. Think about how it made you feel. Was the lie so impactful that you could not eat because you were sick to your stomach? Were you unable to sleep? Did you cry for hours on end and when you learned the truth? Did you feel deceived? Were you able to recover from the lie, and what lasting impact did it have on you? Now imagine for just a moment that you are one of the 12 million people in the United States that are told each year that they are sick when they're not. Or perhaps that they're not sick when they really are. According to medical news today, 1 in 20 people each year are misdiagnosed in outpatient clinics. Can you imagine if that was you? I can. In 2013, I was diagnosed with rheumatoid arthritis, also known as RA. At the time, I was 40, and I pictured myself in a wheelchair by the time I was 50. I told my then boyfriend, now husband, to leave me. Every time my body ached, I would wonder, is this it? Is my RA settling in? Can you imagine the number of doctor visits I made, smelling sick all around me, seeing crippled people in the waiting room, hearing people cry out? Can you imagine in the last 3 years how many pills I've had to swallow and tubes of blood that have been drawn, leaving my body bruised? As I think of that, I'm angry. I'm angry for me, and I'm angry for the several of you in this room today that it could happen to, and very well probably will. You see, in January of this year, I sought out another doctor. It was simply placed in my spirit to do so. I do not have rheumatoid arthritis, nor do I have any other condition that requires medical attention. Those were the findings. Because I am a survivor of a misdiagnosis, today my goal is to inspire you to get a second and even a third opinion when you receive a life-changing diagnosis. I encourage you to not settle for whatever disease the doctor has placed your name on. Instead, my hope is today to shock you into not accepting what you have been told is your fate, and that you will seek an additional opinion. Now, I can understand why some of you may not want to. Perhaps the doctor you go to is reputable, or you've been seeing them for years and you feel loyal to them. Today, however, we will discuss the ramifications of a misdiagnosis, including the financial burden, mental anguish, and health risks associated with it. First, we will touch on how a misdiagnosis can financially destroy you and your family. Next, we will cover the mental casualties of a misdiagnosis. And last but not least, we will consider the health risks associated with the misdiagnosis. To begin, the financial burden of a misdiagnosis can be overwhelming not only for patients, but for insurance companies as well. To quantify that, let us just for a moment consider a patient that maybe makes $80,000 a year. With the serious diagnosis of cancer, this patient could end up missing a half a year of work trying to survive on the mere 60% of income that disability pays. To place a number on that, it could impact your salary, even if you have disability benefits through an employer, by about $2,500 a month. Now calculate the cost of a tank of gas and the numerous trips to and from the doctor's office or hospital for treatments. How about the cost of medical care itself? With the rising cost of health care, many are choosing high-deductible health plans. When you talk to consumers, they tend to gravitate to the plan with the lowest premium, says Doug Gertner, President and CEO of Change Healthcare, a company focused on enabling smarter healthcare choices. With deductibles typically $3,000 or more, coupled with co-pays after meeting deductibles, families can expect to fork over thousands. I can personally attest my medication cost me over $200 a month out of pocket, and I have excellent health care coverage. That equated to about $7,000 for me over a course of 3 years. Insurance companies are taking a hefty hit on misdiagnosis as well. For example, according to CNBC, a recent study proved that false positive mammograms have led to an explosion in breast cancer being incorrectly diagnosed, equating to a whopping $4 billion of healthcare funds wasted. Malpractice suit payouts in 2012 were $30.6 billion, according to the National Practitioner Data Bank. We'd have to be foolish to think that none of this bled over to our premiums, causing substantial hikes. Now that we have a clear understanding of the financial hardships created by a misdiagnosis, let's discuss ways in which it can take a mental toll on the victim and their families. Mental anguish will oftentimes overpower your life. Pain and suffering knows no boundaries. This can equate to physical and mental distress as a result of emotionally dealing with the prognosis you just received. It can lead to depression, nervous breakdown, fear of the unknown, and anxiety. I remember sitting there feeling guilty for my husband that would have to take care of me for the rest of my life. The patient will likely suffer a loss of quality of life. Perhaps you're unable to participate in sports activity you enjoy or a hobby that you rely on to calm your nerves and bring you peace. What if you can no longer care for your small children and you had to rely on somebody else to do that for you? Try to imagine the moments you would miss. There, we have covered how a misdiagnosis can create financial hardships and lead to mental agony. Let's now explore how a misdiagnosis can equate to serious health risks. Health risks and a shortened life expectancy can be encountered. Oftentimes, as a result of misdiagnosis, we succumb to serious health hazards. Patients are often exposed to additional testing and quite possibly extensive treatments, including chemotherapy and toxic medication. I personally felt worse taking my medication as opposed to when I didn't take it. Our lives may even be cut short as a result of being misdiagnosed. 90% of misdiagnoses lead to serious injury or death, according to Evan Richardson, VP of Product at Grand Rounds. What about the instance of a misdiagnosis in which the doctor states you're healthy when you are not, and your body is riddled with cancer? In closing, you would not expect a lesser salary than you thought you deserved. You would not pay more for something than what it was worth. And you would probably not believe that you were going to win the Publishers Clearinghouse unless Ed McMahon knocked on your door with a check in hand. So why would you ever accept the fate that one has given you without doing your due diligence? We just talked about the ramifications of a misdiagnosis, which includes financial stress, mental anguish, and serious health risks, including loss of life. Are you worth that extra visit to the doctor? My name is AutumnLockhart, and I got a new lease on life. I'm worth it.